Good evening, everybody. We are again here from the EIZOC platform, our Ophthalmic Research and Publication Initiative, ORPI webinar series number 7. I welcome all our faculties, mentors, and our speakers and each and every one. At the onset, my sincere thanks to Dr. Chaitra Joydev, the mentor of the whole program, and our president, advisor, Dr. Ajit Babu Majhi sir, chief coordinator, Dr. BNR Subudhi sir, and co-coordinator, Dr. Santosh Mahapatra. And today's speaker is none other than our chairman scientific committee of the EIZOC, Dr. Sabyasachi Patnaik. We had few moderators, Dr. Prafulla Maharana and Dr. Natasha Dash, and we had a panelist, Dr. Sudipta Ghosh, Abhishek Gupta, Suchitra Bhoy, Dr. Sharmishta Madam, Dr. R. Rohit Modi, and Dr. A. Raghu. And we have a lot of discussant, young, dynamic discussants. They are from different institutions all over the India, mostly are the PGs. And I welcome everybody to this meeting. And over to Dr. BNR Subudhi sir for continuation of the program. Thank you.
Thank you. So let me share the screen. Okay. Good evening. Once again, I welcome you all to this Ophthalmic Research and Publication Initiative series number 7. So respected President EIZOC, Secretary Dr. Swaraj Bhattacharya, our Chairman Scientific Committee Dr. Sabyasachi Patnaik, Mentor Dr. Chaitra Joydev, and my co-coordinator Dr. Santosh Mahapatra, and all the panelists, moderators, and the participants today. So I welcome you once again because it's already over 1 month, and we have today, I think even Dr. Gaur Ahmad is here. He has joined from Kashmir Valley. So I welcome you, sir, to this program today. So we conduct these programs every fortnight, this EIZOC, ORPI, and ORTS programs. Today, in this series, we have got a very interesting topic, study design and planning for biomedical research by none other than our Chairman Scientific Committee, Dr. Sabyasachi Patnaik, the speaker for this program. Okay. I welcome our advisor, Dr. Ajit Babu Majhi. I think he will be joining a little late. So, mentor, Dr. Chaitra Joydev, already I told that she is the behind this program since the last, I think, 2 years. It was in the state level, now it is in the zonal level. Along with me, our Chairman Scientific Committee, Dr. Sabyasachi Patnaik, we are always there for these programs. So, today's speaker, I think, is a well-known figure in India, in the EIZOC states, in Odisha. So, he is none other than Dr. Sabyasachi Patnaik. He is the Additional Director, Health Services, placed at now at Rourkela, Odisha. He was trained at Arvind Eye Hospital, Madurai, and Nelli Prasad Institute, Hyderabad. He did a Commonwealth Fellowship on Commonwealth Fellowship on Diabetes Retinopathy at Inter Center for the Eye Health, London. And he has a lot of interest in community ophthalmology, tele-ophthalmology, and DR screening. And sometime back, he was chief coordinator for our Sunetra program in Bhubaneswar. So I welcome him, Dr. Patnaik, to throw some light on the today's topic of the study designs. Today's moderators, I know Dr. Prafulla Maharana, everybody knows him, is the assistant professor at AIMS, Delhi, and Natasha Das, the chief consultant of Hazel Consultancy Station at Bhubaneswar. Our today's panelists, Dr. Sudipta Ghosh, I think everybody knows her. In the Eastern Zone, she's a very well-known figure. And she's also a very community ophthalmologist. She's always with us, with me, long time, such a long time. She's the chief instructor for the State Faculty of Medical Sciences of West Bengal, and guiding a lot of optometrists in her state. And she's a consultant for cornea, glaucoma, retina, everything, I think. She has got almost a consultant in almost all the branches of ophthalmology. She is based at Calcutta. And our next panelist is Dr. Abhishek. Abhishek, one of the young dynamic from Delhi. He owns, is the founder director of who? Sunitram Eye Care at Delhi, along with Dr. Richa Gupta, daughter of our president, Dr. B.N. Gupta. Wonderful job he is doing, a lot of retina surgeries he is doing in Delhi. And other coordinators, I'm a panelist, Dr. Sachala Bhai, she is the professor at MKC Medical College, Ophthalmic Department, and Dr. Samishta Behra, associate professor at Burla. Then Dr. Rohit Modi. Dr. Rohit Modi is from Bombay. He's a practicing veterinary surgeon. He's a fellow of Ali Prasad Eye Institute, Hyderabad. And Dr. Raghu is the senior resident at MKC Medical College, Berhampur. And all this discussion is the postgraduate students from the different institutes of our country, mostly from eastern states also. So I welcome you all to this program, and I request all of you, all the discussions to come forward and ask questions to our speakers and panelists. Generally, it becomes a very interactive session. It should not be one-sided. The speaker's speech and others remain silent. So with these few words, I welcome you all once again to our ORPI 7, Series 7. So it is over to Dr. Chaitra to say a few words before we start the program.
Thank you so much, sir. And besides, I just have 2 points. One is about the speaker. I think his enthusiasm at getting us to increase our scientific, publication spirit, I think I have seen for the last few years, and it's commendable because, most of us don't have that zeal that he has, and I'm amazed at it. So keep at it, Dr. Sabyasachi. I think that's the reason why we've been able to push so many meetings along with support from Dr. Subudhi. And second is the topic itself. I think without really knowing the study design, many of them set out to do research. And somewhere halfway along the way, they realize that the design itself is wrong. And we see a lot of reviewers commenting that, the study design was wrong. And hence the hard work goes in vain because the paper gets rejected. So I think designing the study at the start itself is very, very important, and therefore plan for a better biomedical research, and therefore a very, very important topic for the day. Thank you, Dr. Sabyasachi, for choosing that and going forward to speak about it. And thanks, for making me a part of ORPI. Over to you, sir. So you're muted, sir.
Now it is over to Dr. Sabyasachi Patnaik to start the talk.
Yeah, he's muted.
Thank you, sir. Thank you very much for the nice introduction. I thank Dr. Chaitra for being with us for the last 2 years and encouraging us in every step of this program. Otherwise, it would not have been possible to continue this program. So with this, I like to discuss, as Dr. Chaitra has already mentioned, study design is a very important aspect of any biomedical research or any research. So what exactly is? We as clinicians mostly responsible to see that our people remain healthy. So the healthy people can only make a healthy medicine. So this is our primary responsibility as doctor, as clinician, as ophthalmologist, whatever field we are in health. This is our primary goal. So research is an important component because it will provide us better ways to prevent and treat diseases that cause illness and death in people and in animals. So health research is an evolutionary process. It's not a static process. It's a dynamic process requiring careful experimentation by many people, many scientists, including biologists and chemists. So whatever treatment or whatever method that we are using for treating patients are the product of many experimentation that has been done by so many people before. So we have to also continue that. So discovery of new medicines and therapies require careful observation. This is the first thing. We have to observe very carefully what we are doing. Then scientific experimentation, and we have to repeatedly evaluate whatever we have known or whatever we are studying. We have to evaluate that, whether that is proper or there is any better way of doing the things so that we can alleviate the sufferings of the people. So Now, the fundamental question is, how can health of population be improved? How can various diseases be prevented? How can we predict occurrence of a disease in an individual? How can we effectively cure the diseases and reduce the cost and also the associated morbidity and mortality? What are the various societal, community-based and programmatic interventions for disease prevention and control? These are the broad focus areas. Along with that, one is our requirement for promotional avenues and other things for which also we have to conduct research. And the second thing is, as the postgraduates or residents, we have to do research to publish, to complete our thesis for the purpose of completion of the course. So broadly, these are the reasons why health research is very important for all of us. So it is not that research means we have to invent something new. So getting additional or new informations or already known things also a very important aspect in health research. We have to verify and confirm available information. This is also one important aspect. Explaining the cause and effect relationship of any disease or any factors that is associated for causing or enhancing a disease. Testing new drugs, vaccines, tools, or interventions for prevention, treatment, and control of disease. New surgical procedure, anything like that. Evaluating ongoing programs and assessing feasibility of new programs. So these are the broad scope of health research. So in any area, if we can work in any of these areas, that means we are contributing to the health research. So health research can be done at individual level and also at the community level. So individual level, promote healthy behavior, personal prevention, early diagnosis of disease, adequate and appropriate treatment, rehabilitation also. At community level, improving community behavior and practices of certain communicable and non-communicable diseases. Prevention and control program of diseases, those national program or state programs. Then supporting the affected people and stigma reduction. So broadly, these are the scope. So coming to the medical research proper, research can be classified or divided into primary research and secondary research. So when the researchers collects data himself by conducting studies, this is known as a primary research. But when you evaluate data of your published or someone else's primary research, then that comes under secondary research. Now again, those primary research can be secondary research mostly concerned with review articles and meta-analysis, systematic review, narrative review, and meta-analysis. These are higher scope. So initially we have to concentrate on our applied research. Then subsequently we can think of going into secondary research. So again, primary research can be theoretical research and applied research. Theoretical basic research are mostly laboratory research. And applied research can be clinical trials, epidemiological trials, and certain basic applied research. So study design is very important to decide when we want to conduct a study, what is the proper study design for that study. So study design are set of methods and procedures used to collect and analyze data in a study. So what are the methods to be used and procedure to collect data and analyze that? Scientific value and informativeness of a medical study are determined to a major extent by the study design. When you want to publish your study or your findings, then what mostly required to be assessed whether the study design is proper for that study question or not. Whatever you wanted to study, whether it has been done in a proper study design method or not. So this is the basic primary thing. The errors in study design cannot be corrected afterwards. So we have to decide your study design initially before starting the study, and you have to specify that in the study protocol. So first thing we have to decide in study design or in study question, whatever you want to do a study, whether you are assigning any exposure or not. If you are not assigning any exposure, then that comes under observational. If you are doing an intervention, then that comes under experimental study. So broadly, we have two types of studies, observational and experimental. Most of the studies that we conduct or we do are observational studies. They are also known as hypothesis generating studies. We generate hypotheses to be established by conducting experimental studies. So experimental studies are also known as hypothesis testing studies. Involves an intervention that tests the association between the exposure and outcome. In observational study, we can say that there is some association. So again, observational studies can be two types, descriptive and analytic. The main difference is if there is a comparison group, then this is an analytic study. And if there is no comparison group, this is a descriptive study. So this we have to be very clear in our mind. What is analytic and what is descriptive? In analytic, there is always a comparison. If the title is comparison between two type of test, two types of things, when there is comparison, this comes under analytical study. In experimental study, clinical trials, field trials, and community trials. Clinical trials are again can be randomized trials, non-randomized, crossover, and factorial. When two things are compared simultaneously, then that is known as a factorial clinical trial study. So broadly, then coming to the descriptive and analytic, in the descriptive study, there are three types: case reports, case series, ecological study, and cross-sectional study. Analytical study is a cross-sectional analytical study, can be a code study or a case control study. So descriptive observational studies provide a description of the exposure or the outcome. And analytical observational studies provide a measurement of the association between exposure and outcome. There is an association between exposure and outcome. Association is not causation. So to find out causation, suppose glaucoma is associated more in diabetics. So to prove the causation, we have to do experimental study, not observational study. So in descriptive study, what we do, what we study is what is it, where is it seen, when it is seen, and who are observed, not why and how. So why and how means we have to have a comparison. So in the title, the word that is described for analytical study is determinism. And for descriptive study is to be the estimation. So if in the title the word estimation is used, then it is a descriptive study. There is no comparison group. When determination is used, that is analytical study, and there is a comparative comparison group. So in descriptive studies, we use descriptive statistics, mean, rate, proportion, frequency distribution, population parameters, and data. In cross-sectional studies, single point of time it is observed. Generally, they do not have a follow-up period. Once, cohort study compare disease occurrence between exposure and non-exposure. In case control study, compare the presence of exposure between diseased people and healthy group. So descriptive is used for estimating a quantity. Analytical determine whether exercise reduces blood sugar or not. So when there is a comparison and the term used is determine, it is an analytical study. So coming to the individual studies, case reports are the basic type of studies. There is detailed presentation of a single disease. It can be a new or unfamiliar disease, or rare manifestations of known diseases. So this is used to generate hypotheses regarding pathophysiological mechanism. It is useful to teach or share experience with others about new diseases, unfamiliar diseases, or rare manifestations of common diseases. Mostly care statement is used in writing case reports. So we have to know beforehand, there are standard protocols to be used for different type of studies. So for case report, care statement is used. And this is a case report published recently in EIZOC, a rare case of congenital unilateral dry eye. So here the authors, they have found out unilateral dry eye, and the cause they have mentioned isolated congenital unilateral lacrimal gland agenesis. So most of us are not acquainted with this disease. So those who are doing research or those who are interested in lacrimal gland diseases, they can take it as a clue to do further studies. So this is known as generating hypothesis to conduct further research. So from their observations, we can think, yes, this is a possibility, or what is the rationality of their observations in our society or in our practice. So in this way, case reports also helps to plan for your further studies. This is another case report. MultiTarget Microangiopathy in a young healthy man with COVID-19 disease. Now, COVID-19, as we know, we are not exposed to its all types of presentations. So any presentation during COVID also got published because of others to know that these are the possibilities. So here the authors have mentioned about multi-target microangiopathy. So what they have found out that in COVID, along with CRAO, partial central artery occlusion, there are also occlusion of the retinal vessels, presenting like puncture-like cotton wool spots in the posterior pole, along with cherry red spots. So this is a possibility they have observed. Now coming to the case series, this is a study of larger group of patients, usually more than 10 with a particular disease. This allows the investigator to assess the play of chance, common way of delineating clinical pictures of the disease. Now this is a case series of pneumocystis pneumonia. They observed in 5 patients this pneumonia, which ultimately led to the discovery of AIDS. So case series also has importance in research. Now this is a case series, clinical profile, multimodal imaging and treatment response in macular serpiginous choroiditis, published very recently in EIZOC. So what they have observed is macular serpiginous choroiditis in 16 eyes. And they tried to prove whether it is different from chronic serpiginous choroiditis. And their conclusion is both are similar. Though presentation is different, but the etiology and treatment modalities are similar. So this way, case series also can contribute a lot to the existing knowledge or to new knowledge. Now coming to another descriptive study, those are known as the ecological studies. Here the group as the unit of analysis, not individual. So no individual level of information on the distribution of exposure and disease. So relate whether populations with high rates of disease also have high frequency of the suspected exposure. Estimation of prevalence and incident rates and causes of blindness in Israel from 1998 to 2003. So what they have studied is the retrospective review of annual report of National Registry of the Blind in Israel. So there is no individual level of study. You have to study the records and data to conduct this type of study, which are mostly related to the population, not individual. Then the next type of study is the cross-sectional study. This is the commonest type of study design. So the commonest example is census. Census is a cross-sectional survey. So what we found out in cross-sectional study, observation of a cross-section of a population at a single point of time. These are not follow-up studies. Single point of time, you observe your factor whether that is present in your study population or not. Collect information about disease burden. So these are known as also prevalence studies. What is the prevalence of retinopathy in diabetics? So this is a cross-sectional study. So recruitment of study participants can be population and population sample. There can be observation of presence of one or more outcome or one or more exposure. Prevalence of retinopathy in diabetics can be a descriptive study or an analytical study. If you use estimate, then you take diabetics only and you find out how many percentage of the people have retinopathy. To determine prevalence of retinopathy in diabetics becomes an analytical study. You have to do a comparison group where healthy individuals are taken and you find out the retinopathy in diabetics and retinopathy in non-diabetics and can predict or can conclude that retinopathy is more common in diabetics than in non-diabetics. So that becomes an analytical study. So if you are going to conduct that type of study, then your study design is analytical. If you want to study only the prevalence of retinopathy in diabetics, then that is estimation. and it is an observational study. Observational and cross-sectional study. So prevalence of glaucoma in diabetes again can be an analytical study or can be a descriptive. So cross-sectional survey helps us to estimate prevalence of disease or their risk factors, distribution of health problems by time, place, and person. So that will help us to plan healthcare service delivery. Can also help us to set priorities for disease control, generate hypotheses. Advantages and limitations of cross-sectional. Advantages are they are fairly quick and easy to perform, less expensive. Limitation not useful to study disease etiology and not suitable for study of rare diseases. So this is a study published recently, prevalence of incidental and total HIV, hepatitis B and hepatitis C seropositivity among patients posted for cataract surgery at tertiary care center in India. So all the cataract surgery cases that have been posted in their institutions, they conducted these tests, HIV, hepatitis B and hepatitis C. So this is a cross-sectional study. One time they did this and concluded the prevalence, HIV, and hepatitis B percentage is 22.1%. They found out HIV in their case is 0.8% and hepatitis C 0.1%. So this is the prevalence that they showed in their cohort, their population of cataract surgeons who underwent these tests. Again, a comparative analysis of topical corticosteroid and non-steroidal anti-inflammatory drugs to control inflammation and macular edema, published from our state. So there is a comparison. So this is an analytic study. So the title could have been also determination, to determine the effect of topical and non-steroidal. So this is a cross-sectional analytical study. Now coming to analytical study, there are mostly three types. Cohort study. Cohort is a group of people who have certain diseases as risk factors or health outcome, common factors. So cohort study also called follow-up studies. They are generally prospective and inquire what will happen in future. Suppose a group of people are exposed to a particular factor, how many of them are developing disease and how many remain healthy, and not exposed, then how many develop the disease and how many remain healthy. So what is found out ultimately, the relative risk of the exposure causing the disease. So relative risk is the statistical test that is used in cohort studies. Then case control study. We have to find out presence or absence of factor in cases and controls to establish that this factor causes this disease. Case control studies are conducted retrospectively to inquire what happened in the past. Cases are subjects selected according to presence of disease or clinical outcome. However, control subjects are selected without disease. Cases and controls with disease and without disease. How many of them are exposed to the particular factor of study? Then analytical cross-sectional study, as I have already explained, at one time we inquire whether there is presence of any factor or not in the healthy individuals and in comparison group. So cross-sectional studies are done presently, single intervention, prospective is a longitudinal study, follow-up is required, prospective cohort, retrospective cohort, we analyze the data or the records, case control study is a retrospective study. So when studies find an association between two things, it doesn't mean one thing caused the other. So this is the limitation of observationals. So we can generate only hypothesis, and to test that, we have to conduct experimental study. There are also self-control studies. They do not include an independent control group, but they use the patients as their own control. Before some intervention and after intervention is one example of self-control study. At least two measurements are obtained at different times from the same patients. So here the tests are used are paired tests. Then unpaired test is when two separate groups of population are observed. When same patients are observed before and after, then paired tests are used, statistical tests. Then crossover study include both of self-control and independent. They are powerful but not always possible to apply. In crossover studies, patients are assigned to two groups, placebo or experimental, for example. So after a time, the research is interrupted for a washout period and patients receive no treatment during that period. At the end of the washout period, experimental treatment group receive the placebo and placebo group receive the experimental treatment. Mostly in ophthalmology, we do it in glaucoma studies, those drugs. So the effect of treatment or intervention is determined by comparison of both self-control and independent group. Another type of studies are diagnostic accuracy test study. Investigate the effect of a diagnostic method such as imaging or pathological compared with the gold standards. These are similar to case control study, and START checklist is used while publishing those type of studies. So one example is the diagnostic ability of superficial vascular density measured by optical coherence tomography angiography, OCT angiography, to differentiate high myopic eyes from eyes with primary open-angle glaucoma. So what they have left out in the title is coherence tomography angiography of peripapillary vessels. So that should have been there in the title to make it more clear. So what they have studied is the diagnostic ability of vascular density measured by OCT angiography of peripapillary vessels to differentiate high myopic eyes from eyes with primary glaucoma. So they concluded that OCT angiography is a useful diagnostic tool in distinguishing glaucomatous and myopic eyes. So the measurement of peripapillary SVD has a greater discrimination ability. That is their conclusion. So these are type of studies where diagnostic ability of one particular method is compared with another method. Then there are surgical technique studies also. Our petal inverted flap for internal limiting membrane in myopic eyes with macular hole and regumatogenous retinal detachment. So you can do studies on surgical techniques. We have some technique that you think that everybody should know about, which makes the disease or the treatment more effective. And that also you can do a study and publish. So coming to the evidence level of medical study, they say that meta-analysis and systemic reviews are the highest level of studies because that is properly planned, scientific, and their conclusion are more authentic. Then next to that is randomized RCT cohort study, case control study comes next, case series and report has less. Then editors note expert opinions. So these are the level of evidence, but it is not that case reports or case series are less important than that. But this is analyzed or used like this sequence. So in order to do a prevalence study, cross-sectional study design, to know the incidence of a disease cohort, to know the cause association, cause-effect relationship, again can be a cohort, can be analytical case control or a longitudinal study. To assess the prognosis of a therapeutic cohort study can be planned, and treatment effect mostly experimental study or clinical trials. So these are the different study designs and the advantages. As I have already described, case reports, one or few subjects. First form of the primary form of publication, you can start writing from case reports. Those who want to start their publication or writing, you can start from case reports. They have very limited potential to establish causal effect, but not very. Also, it has its own significance. Indian journals have come out with Indian Journal of Case Reports. So you can get a good chance of publication of your case reports. Case series, detailed description of cases without a control group. They are also used for hypothesis generating. Cross-sectional study, exposure and outcome measured at same point in time. Subjects with and without outcome are compared. useful to describe the prevalence of disease. This is fast and inexpensive and helps us to generate hypotheses. Then case control study, cases and controls are compared for the presence of any factor. They are efficient, suitable to study rare outcome and multiple exposure, relatively inexpensive, and also helps in generating hypotheses. Then cohort study difficult, little bit. A cohort subject free of outcome is followed and compared based on the exposure. Suitable to study multiple exposures, rare exposures, and multiple outcomes. Again, helps in hypothesis generating. Then RCT to find out the effectivity of any treatment model. So these are the checklists that are used. So arrive checklist for animal research reporting, care statement for case reports, stroke statement for cross-sectional case control and cohort studies, consort statement for RCT, STAR for diagnostic accuracy, SPIRIT for intervention trials, PRISMA for systemic review and meta-analysis, MOOS meta-analysis of observational studies in April. So these are the checklists that we have to use when submitting an article of this particular studies for publication. So research design. So research design or planning a study again starts from problem identification. You have to find out a problem which we want to study. Unless there is a problem or there is a question, there is nothing to study. So what is your study question that you have to define first? And depending upon that, you have to decide whether this is a hypothesis generation or a hypothesis testing. Then this becomes a descriptive study and this becomes an analytical study. Then depending upon that, you have to decide appropriate study design. After that, you have to prepare the protocol where everything should be written like decision on the method of data collection, what are the data to be collected, how to be collected, who is going to collect. Then data analysis plans also you have to mention your protocol. You have to prepare dummy tables, what software you are going to use to analyze your data, and what are the statistical tests applicable for this study. Next thing is ethical approval. We have to take ethical approval for all types of studies. For primary, even for secondary studies, when you are not directly dealing with patients, only with records also, ethical approval is essential. Then consent from participants. Then comes your proper study. That starts from data collection, then data analysis, then drawing conclusion and recommendations. So after that, you can think of either publication or sending it to competition for AIOS or ARC that we are regularly having. So common reasons for study failure are badly defined research question and objective. We have not properly defined our study question. What we want to actually study and what is the objective of doing this study. Unrealistic time scale, too short or too long. Inappropriate and incompetent staff for collection of data. Lack of direction, motivation and training. Inadequate monitoring, failure to respond to contingent situations and carry out mid-course corrections. So ad hoc approach to conducting a research study is often non-productive. Ultimately, that will lead to a disastrous result. You will have data, but that will be very difficult to analyze and no conclusion can be derived out of that. So each study design has specific advantages and disadvantages. Knowing how a study is designed is important for understanding the conclusions that can be drawn from it. Because whatever study you want to do, that has to be for the benefit of the people or the persons. So that is to be implemented or that is to be followed by others. So unless it is properly done, no one is going to take it very seriously. So if a study is properly planned, the factors which distort or bias the results of a test procedure can be minimized. The question to be answered and the strategy for evaluation of results must be specified in the study protocol. Study protocol is very important before starting any study. Errors in design cannot be corrected after the study has been completed. So study design must be planned carefully, basing on the study question before starting the study and specified in the study protocol. So briefly, this is what I have understood about study design. I tried to explain. Now I request questions or any discussions on this presentation. Thank you, sir. Thank you.
Thank you so much, Dr. Sabyasachi. It was quite a concise talk. Frankly speaking, when our students do our thesis and they have to submit their papers and all on thesis basis, so usually the explanation of regarding about how the study should be conducted should be explained to them properly. Like they need a proper mentor who actually understands this. Not everybody understands the reality or the actuality of these studies, actually the cohort or the random control trial. And the person who is dealing, like the guide, who is the postgraduate guide, needs to know about the particular things before a thesis is conducted for a postgraduate student, I feel. So knowing the basics is very important to conduct a study based on research, actually.
Very true, very true. We have also come through the same process while doing our post-graduation. Most of us, we didn't know what type of study design and how it is to be planned. But with availability of all materials and information, now in the present age,
one more thing is very poor is data collection.
Yes.
The fact is that not everybody of us have the infrastructure for us to, collect the data properly. Documentation is not there. And the patients also are lost to follow up, because usually they go to, instead of sticking on to one doctor, they go to multiple doctors. So in that case also, the patients are lost actually. So
there are also, that is true what you are saying, but loss to follow-up also can be addressed statistically. There are also methods. So how many study participants were enrolled, then how many loss to follow-up. That also can be, all these things comes under this, knowing this study design. First you have to plan what is the study design that you are going to have to answer your questions. Then other things, if you have designed it properly, the next step is the protocol. What we don't give importance to is writing a protocol. Mostly study protocol addresses all these things. Yeah, what is the method used, how the data have to be collected, who are going to collect it, how efficient they are, what is the interpersonal variability or intrapersonal variability. There are many things to be decided at protocol level. So once the protocol is designed properly, then proper study or analysis becomes easier. So what
one more drawback of doing the research is a lack of a proper statistician who's going to do the statistics part for you all. Because we are novice. In the Excel sheet, probably we can do the mean, medium, we can do the average, we can do all that. But the hardcore statistics.
Analytical, for descriptive statistics, yes. For descriptive statistics, you can use Excel and do that. For analytical statistics.
And if you want to do these meta-analysis or you want to do something else, then, it's very
difficult. You have to use proper software and statistics.
Yes.
Very right. Very right.
And research actually is very, it's helpful if you do it in an institutional sort of setup. An individual practice person may not be able to do research the way he or she wants to do it. So if it's an institution thing, you have hands, you have postgraduates, you have, other people to take care, collect data, follow up the patient. You need hands-on to do the research, actually, proper research.
Sure. That is correct. That makes your work easier. But the message is not that the individual practitioners cannot do research.
No, they can do, but it is more time consuming for them.
Yes, it will be difficult for them to do in comparison to those who are working in institutions.
In an institution. Yes.
That is very right.
The students will be more enthusiastic to collect and run after the patient and collect data, get their photography done, rather than probably an assistant or somebody to an individual practitioner.
That is correct. I can give you an example. Harminder Dua's past, I had him saying, what was his past research? His past publication is how the corneal ulcer heals. What he used to do is any ulcer coming to the OPD, he used to stand that and take a photograph. And that becomes a landmark study, because never before no one knew that how the corneal epithelium heals. So he gave that concept. That is his first paper published. And he gave that concept that corneal epithelium heals in hourglass pattern, not circumferential, which was the common belief before that. So simple observations also in a clinical practice can give rise to landmark publications and science.
So I wanted to add here about my experience of working with individual clinicians, especially ophthalmologists from Delhi. It was an individual glaucoma specialist for whom we wrote some of the best articles that we've written so far. And they had really good data. It's about data collection. He had non-doctors collecting the data for him, for all patients that he attended to, and they were put into the digital media. So he had everything on his computer. So since the data was already there, it was very easy for us to help him write those articles. So I believe, if you collect data, even as an individual clinician, you can really do good research.
No, we have to develop a sense of observations actually.
Yes,
Then,
yes.
Then we like to put it down. Because if you will not observe properly, you cannot know what data to collect and what data to be used.
Yes, sir.
Dr. Gover wanted to speak something. Dr. Gover, sir.
Patnaik sir, please unshare your screen.
You're muted. Dr. Gover, you're muted.
No, it's all right.
Yeah, now it's all right.
You see, the thing is that this is a basic thing which was done during thesis. When there's a thesis, there's a topic which is given, and you have got a guide, you have got a co-guide. Any topic, we start with an abstract, we start with material methods, we start with case reports, we start with the table, then we start with the discussion conclusion and like that. And then we come to the end of that. I remember that during my MS, I had a colleague, a topic who was given effect of cannabis indica on intraocular tension. Cannabis indica usually lowers. It was an experimental study. That doesn't mean that the cannabis indica should be given the glaucoma patient. It was only an experimental study that we know that the bang, cannabis indica, lowers the intraocular pressure, causes a conjugate deviation of the ocular movements, lowers intraocular tension. And my colleague, in the Agra, you have got a chronic bronchitis. They were the groups who were the guides, and the intraocular tension was measured, it was low. And other guide was a pharmacology professor who would make the injections of this bang. It was injected in the rabbits, and then you would sort of do the IOP, and the tension was low. So we know that this is a basic thing that when we sort of do a thesis during our masters, we do like sort of this thing that you write an abstract, material methods, case reports, discussion, conclusion, and observation, and finally the references. Now that thing is now basically now go into the clinical practice, as we know that we have got a community ophthalmology and we have got a tele-ophthalmology, and in sort of that things we go aside. And before, 40 years before, we had a general ophthalmologist, we would do everything. Now you have got a community ophthalmologist, you have got a laser, you have got a LASIK, you have got a pediatric ophthalmologist, you have got a oculoplastic, and so on and so forth. So the things have moved forward. That's what I wanted to say.
Any of the postgraduates? The postgraduates, would you like to ask something and would you like to comment anything? The postgraduates?
Sir, one question.
Yeah, please carry on. Dr. Sachala, please carry on.
Sabyasachi sir, while writing a thesis, what should be the sample size?
You are asking me?
Sabyasachi sir.
No, sample size is to be decided not during writing the thesis. That is to be decided at protocol writing. When we want to do a study, then we have to estimate the sample size, how much sample size is appropriate for this type of study. So there are different softwares available to calculate that. And you can also do that because basing on your objective, study objective, and what is the outcome. If you are going to have a proportion or the comparison of mean, suppose we have two estimations, the quantitative study. Then for that different formula is used. So basing on your objective of the study and the outcome, then there are different formula to use, and there are other factors also, power of the study, then precision, how accurate you want the difference to be. So these are mostly done by the statisticians, and this used to be done while starting the study, not during writing the thesis, because at that time you cannot do anything. Suppose while writing the thesis, the statistician says that the sample size is not adequate for this study. Then you cannot do anything because you have already concluded your study. So this is to be decided at the beginning of the study. Mostly statisticians will help you and find out this the sample size.
Can I add something?
Yes, sir.
You see, the topic for the thesis has to be decided by the guide and the co-guide. Whether he will give a topic on a glaucoma or a retina, that depends. Long back in Agra, our professor was very much interested in glaucoma. He was a very long back professor at the university. I mean, he's no more. So he would give all the topics on the glaucoma, like he would give effect of bung intraocular tension, effect of corticosteroids intraocular tension, efficacy of a trabeculectomy as an anti-glaucoma operation. And my topic that I passed my MS in '76 was effect of age on intraocular tension, refraction, synchronogity, and facility of aqueous flow after 40 years. It depends upon the professor, what is his interest and what is his research, what he wants to get from a PG. That depends upon the thing. If he is a retinal specialist now, he will give a retinal topic. If he's a corneal specialist, he will give a corneal topic. Like in, I worked for some time in ORPI Center for Ophthalmic Sciences, and the oculoplastic surgeon that was Dr. Dayal, he usually would give very interesting topics which were very experimental. Like he would give blowout orbital fractures in monkeys. I mean, the student had to sort of, the orbit of a monkey is same as the orbit of a human being. So a student would hit the orbit of the monkey and see what is the orbital fracture. And usually we know that the middle part of the orbit is the weakest part, and the fracture lies there. But then the student has to see there. It depends upon the guide. What is his basically the interest to infuse that into his student.
Yeah, thank
you. Abhishek, you wanted to say something?
Dr. Sarmishta, you want to say something?
Yes, sir. I wanted to answer that question, Sachala ma'am. The sample size calculation actually varies. It varies. I have a booklet with me here, which is published here. We have workshops before a thesis is taken up by the student. The topics are given, and the sample size is calculated mainly by the PSM people. So they have different sample sizes. Say for qualitative variable, I think Dr. Natasha can better explain that. So for the qualitative variable, there is a different sample size calculation method. And it also varies in other studies, like in case control studies, it is something else. I think that Dr. Natasha can explain it more. It varies according to studies.
I think once you decide on this, study that you want to do, you should get in touch with a statistician who will help you calculate the sample size for your specific study. I mean, not just, if it is a original research with a, prospective research, or whether it's a retrospective study, or whether it's a qualitative study, not just that much. Even the topic that you are studying is important. what is the incidence and prevalence of that particular condition that you are going to study. So everything is taken into account. So I think you should get in touch with a statistician as early as possible when you think of doing a study. So they will guide you.
No, the broad thing is, if you are going to do a study on a common disease, then the sample size has to be big. If you are going to do a study on rare disease, obviously the sample size has to be small, because you are not going to get a good number of those cases. This is first. Second thing is, if you are going to, what is your assessment? If you are going to assess parameters, those are quantitative, then assessment of mean, then percentage or prevalence of this particular disease in the community in comparison to another disease, then proportion, there is a different formula. So one can do that. It's not because we are all medical graduates securing very high mark in mathematics. So this is not very difficult. But again, you have to put a little bit of interest and time into it. So the easier thing is to take the help of a statistician at the beginning, so that you can calculate that. He can also tell you what are the tests to be used, what are the methods to be used to collect the data, and how the data will be analyzed. So mostly he will guide you properly during the protocol stage.
That's very true, because you see, it's not only the guide, it's the co-guide. The co-guide could be a department of pharmacology. It could be a department of statistics. For example, I know one of my students in AIMS, he had a topic of experimental orbital mycosis. So his co-guide was a mycologist. So that's right. The thing is that most of the times the co-guides are statisticians, Department of Pharmacology, Department of Physiology, Department of Anatomy, and the associated departments. So it's not only the guide who is your professor, it is the co-guide, depending upon the topic.
Dr. Abhishek, you would like to say something, Dr. Abhishek?
Yes, very good evening, Sabyasachi sir. It was a nice presentation, and we got few very good insights regarding how to research, how to publish a research, and how to carry out the further activities in that sense. But before we do anything, first and the foremost thing that needs to be inculcated in the postgraduates is the habit of reading the articles. So for that, what I feel is that having letters to the editors for the RCTs published in various journals and analyzing them or scrutinizing them meticulously gives them an idea regarding how the article is published, what are the statistic methods that we can apply to the type of the study designs that are being discussed in there.
Yes, very true. We are going to have a separate session on how to read an article. That also we had done earlier, and this time also we are going to have it. How to read an article. This is very important. Unless you know how to read an article, you cannot derive any conclusion out of that study or that publication. Very true.
Yeah, Dr. Rohit. Yeah, please, Dr. Rohit.
Yeah. Sorry, I couldn't join in time, but just to add to what was discussed now, UC conducts beautiful journal clubs every month, and those articles are shared in the UC groups, and there the discussion happens on how to read an article, and the article of the month is also analyzed. So that is also a good platform where the right approach to how to read an article is discussed.
Dr. Raghu, would you like to say something? Hello.
Good evening, sir. Good evening, everyone. Actually, the Sabyasachi sir's presentation was very nice, especially the story of Harminder Sir Dua. How he did his first research were very inspiring. And I would like to say an observation that in all government medical colleges, due to the sheer number of patients, one of the best method of study will be retrospective study. But the problem is that the proper documentation is not happening, since there is a lack of computerization. Still we are following pen and paper method. So the proper documentation, register keeping, and retrieval of like photos and videos are not possible. Taking together all these things and searching the database of previous patients is very difficult. That is why many papers are not coming out of many such colleges. Also, interdepartmental, for example, my thesis was regarding ocular infections. So I had to deal with the microbiology department. So the getting the data from there was also difficult because there is no computerization. So if there is a better computerization and interdepartmental linking, such retrospective studies will be much easier to carry out. Thank you.
Yes.
But one thing is,
The drawback in India, actually.
So the purpose of discussing all these things is not to have everything available with us, but in spite of all our limitations, how can we start thinking about research and we can do that? Suppose previously retrospective data are not available, but for how many days if you are in ophthalmology, then you can also have your data on a particular observation or particular subject, so that after 5 years that will be a landmark study. So retrospectively it is not available doesn't mean that we cannot go on doing prospectively or rectifying or correcting things. So we should try to improve things.
You see that it's not only the question of thesis. In our day-to-day life, we get some very interesting cases in your clinic or this thing, and you can just sort of publish that. You see that
interested in CRVO or VRVO. You go on recording or report or maintaining your data.
You see,
maintain a diary and put it. What is the age? What is the sex? And what are the factors responsible? And after 5 years, you will see that you have published a landmark observation from your own observation.
You see, as a periodic ophthalmologist from 2013, I saw 4 cases of gold horse syndrome. I saw a rare case of a choroidal melanoma present in the glaucoma. I saw a rare case of a congenital corneal dystrophy. These were basically two rare cases which in my 40 years of experience I saw. And what I did is that I published them. And they got published in the European Department of Ophthalmology. And now what happens is that every time I get a feedback, only yesterday I did a webinar on international ophthalmology at about 4 o'clock, where I spoke about a very rare case of a bilateral congenital corneal dystrophy with a rare congenital associated adistyphloma. This is a case which I have seen in 2013 in a first cousin married couple, and very interesting. And this case I presented in South Asian Academy of Ophthalmology in 11th November 2022 at India Habitat. Probably this is the 4th in the literature in the world. You get a case like that with deafness, with the antistobloma, with the congenital xerosis, and my case probably is 3rd in the literature. So if you get such a case, it is better for the people, especially the youngsters, to publish that.
Right.
Recently I listened to Arminder Dua's presentation in Kerala Society, virtual presentation. Now Dua's layer that he found out, now very interesting thing, very simple thing he said. He observed descent detachment. And he told that the descent detachments are not the same. There are 2 types of descent detachment and 3 types, type A, type B, and type C. And from that, he concluded that along with that descents, there is another membrane which is contributing to different type of descent detachment.
Very true, very true.
Bilateral observations that gives rise to landmark. It is not that we think research means something you should have a laboratory, every all facility.
No. You get a day-to-day case report very rarely. You should probably. There is a case or a report in the literature of bilateral congenital dystrophy with congenital absence of descendants membrane.
Again, another thing I want to say from Arminder Dua also, how he developed this type of observation. What he said is when he was doing post-graduation, the another postgraduate colleague that they have at that time, they used to do a competition. So for every case, they do a competition that who is going to find out more number of findings. So we'll find out less number of findings. He is going to give the treat to the other person.
Professor Subhuti sir, when he just, there was a wonderful conference of International Association of Community Ophthalmology in Pahalgam in September. It was a wonderful conference under the leadership of Dr. Swapan Samanta, and wonderful cases. There were about ophthalmologists from all over India. They were from Bangladesh, Sri Lanka, Nepal, and Bhutan, and all those things. And a wonderful conference, and mostly it was concentrated on the community ophthalmologists. And Subhuti sir put a very good session on teleophthalmology.
Right, sir. Thank you, sir. Thank you, sir. So I think that Chaitra, would you like to say give your comments, anything about the topic?
I think there's been extensive discussion, sir, and everybody's added their inputs. So it's not easy for like a one size fits all. Sometimes I think there are more than one option, and sometimes there are no options, and we just have to go with it like a simple case report. So I think Dr. Sabyasachi has covered it well, and the subsequent discussion has deliberated more about it. So I don't have much to add. Thank you.
Absolutely right. It's a really good discussion. I think to summarize, it will go to Dr. Santosh Mahapatra now. Dr. Santosh, I think you have to give a great comment.
No, already, as Chaitra said, it is extensively discussed. Only thing is that the conclusion can be for research, you don't need to have a big institution, just like somebody told, or big laboratory. It is the mindset, clinical observation, and documentation. If you just have a mindset to do research, and you are keen in documenting it and have a good observational skill, you can analyze the data, and definitely you can take help of a statistician as and when required. And you can also have good papers and publications. Just Dr. Sabyasachi Patnaik was telling the Dua's observations led to landmark publications. So our mindset need to be changed regarding research and publication. Nothing else needs to be done, I think. And that should be the take home.
But we have 7 postgraduate students. What is your advice to these postgraduate students? How should they proceed?
See, as we discussed, they can start with case reports also. They can also start with a review article also, as we are discussing the other ORPI.
Yeah.
So anything.
In addition to that, my advice is they should maintain a diary in which every day they have to put down any interesting case that they have seen on that day.
You see, what I have observed in our MSMD, PG as such, they lack the basic sciences. What is the difference between the FRCS and the MDMS? Basic sciences. For example, you have object. One has to sort of know not the cramming. Basically, you have to take the orbit, superior wall, inferior wall, medial wall, lateral wall. You have to pick out the bones which are taking part in all these things. There's a problem. There's a problem. In MSMD, you don't have a part 1 and part 2. You don't have a basic sciences. That is the thing which lacks in the FRCS. For example, as MS or a MD or even in DM, you don't become.
So I think we had enough discussion. So may I request Ms. Krupa to share the video of the host today, then we'll close.
Yes, sir.
Yeah, please. Thank you. Dr. Santosh, again.
Now everybody can come in video. You can have a photograph for. Okay.
So, vote of thanks by you.
I
Where's
just
the
like
your
to
final
thank
comments?
each and
Final
everyone.
comments from Secretary EIZOC.
Okay. Dr. Saraj bhai, are you there?
I think he's not
Okay.
there.
I think it's, yeah.
No problem. I can proceed with vote of thanks.
Yeah,
Yes, yes.
please.
So I'd like to thank all involved in this ORPI programs, starting with my friend Chaitra, who is giving us support throughout since our Odisha state level days. And of course, mentor, our advisor, Dr. Ajit Babu Maji, President and Secretary of EIZOC, the Chairman Scientific Committee of EIZOC, and today's speaker, Dr. Sabyasachi Patnaik, our perennial guide and advisor, Dr. B.N.R. Subudhi, and all the panelists, moderators, and the postgraduates who are part of this wonderful session. I'd like to thank each and everyone. And last but not the least, the entered people for giving us the platform. And with this, I would like to conclude with a message that we all can do research.
Yeah, that's right. Good thing. So whatever you do, just note it down. It will become research. Thank you once again, all of you. Good night.
Good night.
Thank you so much, sir. Thank you for the inclusion.
Bye.
Bye-bye. Good night. Good night.
Bye, everyone. Good night, everyone.
Good night.